part of the $2 trillion COVID-19 relief package signed on Friday, roughly $100 billion is earmarked for hospitals and not-for-profit entities to cover unreimbursed healthcare-related expenses and lost revenue due to the outbreak. But the money's just part of the challenge facing the nationwide healthcare apparatus. Tracking down the valuable equipment and supplies that are needed to save more lives may have forced Trump's hand when he finally decided to invoke the Defense Production Act.
Ventilators are a big deal, and we've delivered thousands of them, and oftentimes you don't need ventilators very much. Hospitals don't have very many, and now we're turning out that we have to produce large numbers.
There's also the factor of having to stay on the good side of the federal government, or Trump in this case, something you think would be a given under the circumstances. Joining me is David Shulkin. He's the former Veterans Affairs Secretary and former president and CEO of the Beth Israel Medical Center and the author of It Shouldn't Be This Hard to Serve Your Country. David, good to see you again. You've actually run a couple of hospital systems. Let's just get to the bottom of this ventilator issue. A hospital has as many ventilators as it believes it probably has to have under normal circumstances, plus a contingency for unusual circumstances. But I guess we don't plan for pandemics. Is that just how we think about how many ventilators we should have normally?
Yeah, I think that's right. I think hospitals try to have enough on hand so that they can handle normal circumstances, but very few have thought about this scenario before and planned for this type of surge in capacity. So I think that everybody has been scrambling to try to get the type of supplies that they need.
Is the ventilator the big expensive thing in a room, in an ICU room? I mean, are there other big pieces of equipment like that we could have some other event that could prove that we need? Or are ventilators always the things that a hospital wants more of, but they're expensive or hard to get?
No, I think we're really looking at the ability to take care of patients in an intensive care unit. And the intensive care unit has very sophisticated monitoring equipment so people can be properly cared for in the setting. And we're also looking at a pandemic like this in terms of rooms that have airflow so that respiratory infections aren't spread into the hallways and into other parts of the hospital. They're called negative pressure rooms. So when we're thinking about pandemics like this, very few hospitals around the country are prepared for this. And so we're seeing our hospital leaders doing incredible things, creating surge capacity, converting areas like operating rooms into intensive care units, changing their ambulatory areas to be able to take care of patients who may need a ventilator. And they're creating approximately 40 to 50% additional ICU capacities in their hospitals. And we're even seeing now the Army Corps of Engineers converting large places that were never meant to do this into settings that could handle this as well.
Let's talk about this flattening the curve that we've been discussing, not bumping up against the capacity of the healthcare system by spreading out the disease. It doesn't necessarily mean that any fewer people will get the disease. It might, the infection, it might mean that, but it means that you're never up against your capacity. Here in New York, we know we're up against our 911 capacity. We were well beyond it for Thursday and Friday and into Saturday. If you're in the city, you're hearing sirens all over the place. We know that some hospitals have ordered refrigerated trucks in case their morgue capacity is full, and we've heard reports of some of that happening. At what point do we consider we're up against our capacity? Is it ICU beds? Is it doctors? What's the thing that says we're there? We're too close. We've bumped up against what we can provide people.
Well, Ali, let's be clear. Our healthcare workers and our systems in New York City, where this is most critical, are doing heroic jobs. They are handling thousands and thousands of patients in their ICUs and throughout their hospitals. And we are, in general, seeing them deal with this about as good as you could imagine any group of professionals dealing with this. But the clear shortage area is staffing. You can't generate experienced staff to deal with patients this sick overnight. And while we have many, many volunteers and people coming to help, it's really our very trained ICU nurses, the physicians, the respiratory therapists who know how to deal with ventilators that are in such shortage. So we're seeing these people working extraordinary hours and putting their own families and themselves at risk to be able to help these people. And I think we should all be incredibly proud. But besides the ventilators and the protective equipment that are so critical that we see shortages of, it's really the human factor here, the staffing and the personnel that are answering the call that I think are really the ones that we have to watch the most.
It is amazing to see the people who are out there on the front lines, the doctors, the nurses, the hospital staff, the other people who work in hospitals, the frontline EMS responders, the police, the fire department, the paramedics. We are really seeing something incredible, David. For all the frightening things that we're seeing, there are things that are bringing joy deep to our hearts. Former Secretary of Veteran Affairs David Shulkin, a medical doctor himself, the author of It Shouldn't Be Hard to Serve Your Country.